do you suffer from headaches or migraines? Today we're getting some medical tips on how to figure out what is causing these and what's the best way to fix it. For more on this is Dr. Chad Domingue, a North Shore physician, getting some answers for us. Thank you so much for joining us.
Thanks for having me.
Thanks. So what is the difference between a migraine and a regular headache?
Yeah, that's a great question. The word migraine gets thrown around all the time. To a neurologist, a migraine means a very specific disease process. So just for your listeners to understand, there's 150 different types of headaches. We hear migraine all the time, and there are real migraines, but there's so many different types of headaches. Migraine implies a specific disease process with your nervous system. So it's very similar to a seizure. It's like an electrical storm that goes off in your brain. It releases a lot of nasty chemicals. It causes your blood vessels to open up, causes a pounding quality, usually one side, sensitivity to lights, to noises. My mother suffered from migraines. These patients are debilitated. They're locked in the rooms, dark rooms, very, very severe headaches.
Whereas the headache, it wouldn't be as debilitating. Is that what you're saying?
Well, there are other headaches that can be debilitating. There's headaches called cluster headaches, which can be very debilitating, but there's a very different quality to it. So when we say the word migraine, we're implying a specific disease process. And that leads into what we'll talk about in terms of treatment, because if you don't identify the appropriate headache, the treatment, for example, a cluster headache is very different than the treatment for a migraine headache.
So how do you determine that you do have a migraine, and what are some of the best treatments for it?
Yeah, so migraine in and of itself is a clinical diagnosis, but when I see my patients, we try to rule out everything else. So we usually get MRIs to rule out vascular malformations, blood vessel abnormalities, tumors, God forbid, other things that can cause headaches in general. I like to spend a lot of time with my patients and talk to them about their history. Is there something in your house, new perfume, new detergent? Is there mold in your house? Did you move to a recent area? So you want to identify a trigger that could be related to the headache. When you go through your due process, look at the imaging, take a history, family history, then you come to a conclusion. And a lot of times it is migraine. But when you take that time with the patient and ask those types of questions, I've identified many times something in their environment that was triggering that headache and didn't have to have me putting them on medications or, other options that so-and-so treated.
That's interesting because, if you really drill down, you don't have to take on a whole bunch of medications, which a lot of people may not want to. And would you approach headaches the same way and your answers in terms of treating them?
Yeah, so in the world of migraine, there's two types of treatment. There's preventative, meaning I'm going to take something every day to keep it from coming. And there's abortive, meaning I got a bad headache, I need to take something. You want to see at least 8 to 10 headaches a month before you put someone on a preventative. The most common would be seizure medicines such as Topamax, antidepressants such as amitriptyline. There's Botox, obviously. There's a new injectable once a month called a Movig that works on a calcitonin gene-related peptide. And then you have your abortives, which would be things like Imitrex or Excedrin migraine or Aleve or those type of things. But you always want to have a nice balance between those two medicines, because what we see a lot, especially in neurology, is rebound headaches. People taking too many medications where their headaches almost feed on the cure being given to them.
That's interesting. I think the one thing I've learned is just to check with your doctor, because sometimes you may be making matters worse by, like you're saying, taking a medication, thinking it's helping. Interesting, and that there's such a difference between those two key things, migraines and headaches. Yeah. Thank you so much, Dr. Chad.
Always a pleasure, Liz. Thanks for having me.
Thanks, appreciate it.